So cholesterol is a type of fat which is found in the body. This occurs naturally, and we need it to do a lot of normal functions, such as especially within the neurovascular system. However, the level of cholesterol can also be increased through the diet and through hereditary means. And if it becomes above normal levels, it can then cause problems. So we have many different types of cholesterol, actually, but you have the two types that you often hear about, the good cholesterol and the bad cholesterol. These are different parts of the total cholesterol, which is measured in the blood. Ideally, you would want to have a lot more of the good cholesterol than the bad cholesterol. And when you go for blood tests, both of these are measured. So it is not just the total cholesterol, it's also the different parts of cholesterol that we look at to decide whether this requires any treatment or not. So there are two main causes of high cholesterol. One is through the diet. So if the diet is very rich in fatty foods, oily foods, this can cause the cholesterol to go up. The other cause of high cholesterol is hereditary. There may be a family history of high cholesterol, and this is related to the way in which the body metabolizes or breaks down cholesterol. In some cases, due to genetic factors, this is not done as efficiently, and the cholesterol is high as a result. So the unfortunate thing is that high cholesterol itself is unlikely to cause any symptoms. So the normal value of cholesterol, if somebody has not had a previous cardiac event, we accept a value of 5 millimoles per liter or less. Now, if that rises to 6, 7, even 8, that may not necessarily cause any symptoms unless the cholesterol has also built up in the heart arteries, where it then may cause chest pain, or if it's built up in the neck arteries, where it may cause some form of stroke. The other features of a high cholesterol before a heart attack or stroke may be a deposition of cholesterol in the skin, which we can sometimes see in the face or around the eyes. But usually, unfortunately, high cholesterol by itself does not cause any symptoms. So it's very difficult to make a diagnosis without doing the blood test, and we must have a high suspicion of high cholesterol based on other factors such as lifestyle factors. So high cholesterol is diagnosed through a blood test, and this is usually done if there is a suspicion of cholesterol buildup somewhere. So, for example, if a patient is complaining of chest pain that we think is coming from the heart, often that's due to a buildup of cholesterol in the arteries. So we'll do a blood test. There are many other potential symptoms, such as if the patient has a stroke or the patient has a mini stroke, then the cholesterol will be checked. We also know that above a certain age in Western societies, the diet and lifestyle is such that the cholesterol usually rises with age. So usually over the age of 40 or so, you will be getting cholesterol checks every few years just to make sure, even if you don't have any symptoms, that the cholesterol is within the normal range. So there's a number of different ways in which cholesterol can be treated. The first way is very much through lifestyle interventions. So we try and understand whether the high cholesterol is due to diet and lifestyle or due to a hereditary cause. If it's due to diet and lifestyle, and even if it's due to a hereditary cause, lifestyle interventions will help bring the cholesterol down. This is through looking at the diet, cutting out foods which are in high cholesterol. Exercise will also help with bringing the cholesterol down. If these measures do not bring the cholesterol down significantly, the next line of treatment is with medication. There's a number of different medications that can be tried, statins, other agents, and usually statins are extremely well tolerated. And often we find in major studies that when we give patients statins and placebos, which are drugs which are used, which have no content in them, patients often have more side effects with the placebos than they do with statins, showing that statins are actually very well tolerated drugs and very effective drugs to lower the cholesterol and then lower the risk of heart attack and stroke as a result.